Hello and welcome to the 1% Solution. Here you'll find tips and tools to help you acquire physician clients one small step at a time. I'm Dr. Vicki Rackner, your host. Today I'd like to talk about how to leverage relationships with healthcare executives. Over this past week I had 3 different clients who had meetings planned with executives of healthcare organizations who wanted to know, how do I make the most of these meetings? Since the goal is to increase your assets under management, I specifically want to talk with you about how to use this relationship to acquire executive clients, medical staff clients, and donors and sponsors. There are 3 different stakeholders in the healthcare system, and you have the potential to build relationships with each of the 3. First, let's talk about healthcare executives. What do you need to know? Well, number one, they are very well compensated. There's been less than total transparency in the healthcare field, and this includes the executive compensation. Washington State, for the first time this year, required that all hospitals disclose the compensation of their top executives. Here are some trends that we're seeing with executive compensation. First, the CEOs are generating very generous compensation packages, usually in the 7-figure amounts. The C-level executives are not far behind. Physicians are seeing pay for performance. We're seeing the same thing in healthcare executives. Next, we're seeing more and more physicians who are leaving direct patient care and who are entering the ranks of executives. And by executives, what I mean is somebody who devotes all of his or her time to leadership in the organization instead of patient care. Second, healthcare executives are leading in a time of transition. The major challenges, according to the American College of Healthcare Executives, include number one, top of the list, financial concerns. How can the hospital or clinic remain profitable? Number 2 is patient safety and quality of care for patients. Number 3 is how to comply with healthcare reform. Number 4 is patient satisfaction. Next is hospital-physician relations. How do executives persuade physicians to engage in certain best practices? There tends to be an adversarial relationship with executives and physicians, with both sides feeling that neither understands the other. Next, many executives are figuring out how to leverage technology, including information technology. And last, executives are concerned about how to meet the personnel shortages. Next, healthcare executives are business-minded. Now remember, we've talked about some of the ways that doctor clients are different than any of your other clients, and it has to do with their relationship with money. For doctors, money is the ultimate taboo topic. And in a sense, they have a dysfunctional relationship with money. This is not so with healthcare executives. They're financially savvy, they have a functional relationship with money, and reaching out and building relationships with healthcare executives is much like building a relationship with any other business-minded client. How do you build relationships with healthcare executives, either to acquire them as clients or to open the door to other people? The key is to deliver value. You build the relationship with executives by giving them what they want and earn the privilege of giving them what they need. Healthcare executives are generally high-profile people, so it's easy to get to know what they want before you even meet with them. You can watch their videos, read the annual reports, or read some press releases. They're interviewed, they're in the news. Study them, figure out what's important to them. Here are 3 specific things to look for as you do your research. First, learn about the initiatives that are important to the healthcare executive. What are they proud of that they've done in the past? What are their initiatives for the future? Specifically, note sound bites. Are there special words that keep on popping up again and again? By using those words yourself, you will activate their mirror neurons and build likability and trustability. Third, listen carefully for sources of pain. What are their unmet needs? What are the things that really keep them up at night? When you develop some offerings for them, you can frame your offerings in terms of something that they already want. Executives network with executives. So you may decide that executives make a great tribe for you, a great group of people with whom you want to work. If that's the case, then find out where executives network with other executives. What associations do they belong to? What meetings do they attend? What publications do they read? Then you can gain some visibility in those networks. What executives generally do not do is pass your name along to doctors. Executives and clinicians have a completely different mindset, and a physician would not turn to an executive for a recommendation for a financial advisor. As I mentioned, executives and medical staff often have adversarial relationships. Executives are concerned about the bottom line. Medical staff are most concerned about what's best for their patient. Oftentimes, these pull in two different directions. Last, it's important to understand that executives are often very poor judges of what physicians want. They know what physicians need, but many executives do not have a deep understanding of physicians' relationship with money, the kind of information that you're getting. Whenever you present an idea to an executive, let's say you want to launch an initiative, maybe an educational event, a series of seminars, what you always want to do is frame your offering in terms of the initiative that's important to the executive. Let's say, for example, that you know that attracting and retaining top talent is a key initiative for the healthcare executive with whom you're meeting. What you could potentially do is suggest some value-added programs that would support this initiative. You might want to approach them and say something like, hey, I heard you say that you really want to attract top talent. Well, here's an idea that might set you apart. What about if you think about some kind of program for the whole family? Or let's say the executive said they wanted to increase patient satisfaction scores. Well, maybe there's some program that you could offer to the patients and their families, maybe about how to plan for medical finances a little better. Maybe you as a financial advisor have faced some health challenge yourself, and maybe you just want to tell your story at a benefit event or maybe to a group of patients or family members who are sharing a similar kind of struggle. Maybe the healthcare executive wants to fund an endowment. You could potentially get involved with a fundraising activity and potentially reach out to the donors or sponsors who could then become your clients. Maybe the hospital is on a buying spree of medical practices, and you might be able to offer something to integrate the new physicians into the culture of the hospital or the clinic. If you're going to leverage your relationship with a healthcare executive to build relationships with different groups of stakeholders that will be your clients, like physicians or nurses or pharmacists, be very careful about the next step. In general, the healthcare executive will hand you off to somebody else. Be very cautious about reaching out to human resources. In general, they're much more skilled at saying no than saying yes. Oftentimes, people in the medical staff office are the people who are much more likely to help you develop relationships with physicians. In summary, leverage your relationship with healthcare executives. Understand that you could either acquire the executive as your client, or the healthcare executive might be able to refer you to the place in the organization so that you would be in a position of developing relationships with different sets of stakeholders, like doctors or nurses or donors or sponsors. Thanks for stopping by today. Hope that this was helpful. Tune in next week for your next tip about how you can acquire more physician clients.